So we're going back to school. How do we stay safe when we go back to school? What are some of the things we should think about? Well, it's most important that when you go back to school as a student is to follow all the guidelines. Your teachers have worked very hard. Your administrators at your school have worked very hard to kind of get things right for you. And you have to follow that. You have to wear your masks, follow the distancing guidelines. Use your head and sort of anticipate where there might be a problem, a crowd you shouldn't be in. Be smart with your friends. Try to stay a distance from them. You don't want to be around somebody who has COVID because you might be labeled as a contact and you may have to go home. And I think most kids want to stay in school and they want to do their sports and other things. So you should be highly incentivized to do all the right things and cooperate with your teachers and administrators.
Obviously, with schools going back in session here over the past week and early next week, there's a lot of concern, I think, in the community as well as the medical community on what this will mean for COVID increases in cases and the effect it will have on children. I think we need to continue, what we need to promote and continue is to promote hand washing. We have masks that are now mandated in schools, which I know from the medical community we feel that's a good idea. That helps decrease the risk of transmission of the virus for those individuals who may be asymptomatic shedders. And I think keeping that social distance, and that's difficult for young children, it's difficult for high school kids. But I think we've had a couple months here prior to school for children to get used to that.
Secondly, parents at home. You should really set a good example for your kids. That means when you go out in public, wear your masks. Remind your kids and yourself, obviously, to do proper distancing. And so just do all the things that you've been doing and just be very much aware of what you should be doing in public to stay safe. If someone's sick at home, we need to separate that person and realize that they could have a simple cold, but they could have something like COVID-19. So be aware that you can't always tell when you have the sniffles, and be very safe at home. And when somebody gets sick, make sure that they don't infect everybody else in the household.
An important piece of this school year and going forward is when children are not feeling good, they need to stay home. And that's difficult for families in two working parents, or single parents. That's difficult. And I know probably over years past, children have gone to school when they've got a cold or they have a fever and they have a cough. But we're in a different time right now. We're in a pandemic. And so we have to be very diligent on ensuring that our child feels good and is healthy so that they're not spreading that virus.
And if you're not feeling well, you should not go into school at all. And what do I mean by not feeling well? Well, if you have fever, if you have cough, if you have sore throat, if you have muscle aches, even a runny nose can occur in COVID-19. Other things that can occur are nausea and diarrhea. We've identified that as being fairly common in children and adolescents. So those symptoms, if you're ill, don't go in. Don't try to overthink it. It's best that you get tested. If you have an illness that we think is very much like COVID-19, even if your test is negative, it's possible you'll be asked to stay home for 14 days. It's probably likely if you're sick, no matter what the test results are. And then cooperate in every way you can, and then you can get back to school sooner than you think. But you're going to have to, usually if you have COVID-19, we're going to identify you fairly quickly, and you're not going to be in school waiting for the results. You'll be at home. And so that's how it works. So if you get ill and someone does a COVID-19 test on you and they're looking for the virus, first of all, if it turns positive, you will be informed. Your parents will be informed, most likely. And then the public health department will be informed, and the public health department will notify the school and start the process of contact tracing. So the schools have worked out arrangements with the public health department on kind of how to do this. And so the first thing they'll be looking for is any of your close contacts, people you sit next to in class, maybe someone that you've identified as being someone you spent a lot of time with at close range. But anyway, there generally will be several people who will be identified as close contacts. And at that point, they will be asked to go into quarantine. It may be disappointing, but it's real important that you cooperate with that, because people will feel fine after they become a contact. Some of those people will be infected, some will not be infected. The most important thing is we identify the close contacts of infected people so that we can quickly get them out of the environment of the school so they don't keep infecting other people.
The one thing I would encourage as we move through this pandemic is that we continue to wear masks. And wearing masks is protecting the other person. And there has been some resistance in the community and in the country about wearing masks and whether it's safe and whether it's effective. And by all scientific methods, it is effective in preventing the spread.
It's also important to understand that particularly from October onward, we're going to start seeing a lot more of other viral illnesses, the common cold, strep throat, influenza. And there are many other viruses you may not have even heard of that cause illnesses to be transmitted between people. It's going to be confusing. It's not going to be quite as simple as it was in the summertime when everybody who got sick seemed to have COVID-19. So at this point, it's going to be more confusing for your doctors, for your parents, and for you. We're going to have to err on the side of caution, which means some people who do not have COVID-19, who have other kinds of viral illnesses, are going to have to stay at home as well. It's important as a student that you are ready to transition to home or virtual learning as quickly as possible under the guidance of your teachers and whatever guidelines your school has for that. There's going to be a lot of disruptions. Kids are going to be going home, they're going to be coming back, and if we do this in an orderly way and we cooperate, we can keep the infection transmission from getting out of control. There's no way that the measures we've taken will completely stop COVID. Hopefully it will slow it. But you just need to cooperate. It's going to be real important. School's going to be a little bumpy this year. This has not happened before. We really haven't been through this, except at the end of the semester last year. I mean, earlier in the spring when we had to close the schools down. But this is a new experience for everybody, and we're all going to be learning as we go. Sometimes we're going to make mistakes. We're going to have to take a step back. We're going to have to maybe cancel certain kinds of events. We're going to have to make adjustments, but it's all for the sake of safety. Again, I'd like to reemphasize it's very important to support your teachers and administrators at your particular school. They've worked very hard to get school ready. There is no perfect system, so you need to cooperate and comply with all the things they've set up, and to be encouraging, to not be negative. It's real important to understand all the work that they've put in. Also realize that your teachers are throwing themselves into the mix. They can get infected like anyone else. It's been estimated that about 25% of all teachers in the United States are at risk for more serious COVID disease, either because they have underlying medical conditions or because of their age. And so be respectful of what your teachers have done and give them your thanks.